this is towards the end of their life. And if we're not doing everything, and I mean absolutely everything possible, to mean that they can see the people that are important to them in those last months, weeks, days of their lives, then I think we're, failing them from a humanitarian point of view.
Hi, I'm Tobi Osman, founder of Smooth Digital, and this is Tea with Tobi, the podcast that shines a light on the care sector and helps businesses, staff, and care workers provide the very best care. The past year has been the most challenging in the history of the care sector. The UK care industry has experienced over 20,000 COVID-related deaths. Dozens of staff had died. Last June alone, nearly all of the COVID-19 related deaths were in care homes. So we decided for season 4, we want to shine a spotlight on 2020. We wanted to look at the timeline of events, analyze why 2020 was so difficult, highlight the incredible people who saved care, and understand what needs to be done for the care industry going forward. In the upcoming season, we will hear from carers, academics, CEOs, industry leaders, and analysts. We will get a first-hand account of life on the front line. We'll review the effectiveness of the government's response, and we'll discuss how the care industry has changed by the pandemic, what we can do to protect the sector for 2021, and most importantly, we will hear how the industry stood together in times of illness and social distancing, with solidarity and compassion. Please join me in this very special season of Tea with Tobi. On this week's Tea with Tobi, I'm pleased to be joined by the Executive Director of the National Care Forum, Vic Rayner. The NCF is a membership organisation for not-for-profit providers in the health and social care sector. In this episode, Vic tells me about the first time she heard the words COVID-19. We discussed how important technology was in aiding the pandemic response, and we discussed what we need to learn from the past year. But first, I was curious to learn what was on the National Care Forum's agenda in December of 2019. Vic, great to have you on the show.
Thanks, Toby. Great to be here.
Awesome. So we're going to wind the clocks back to around November, December of 2019. Okay. I remember around that time, I was speaking at the Essex Care Association event, and you spoke at that same event as well. Yeah, a couple of speakers later, and you gave an awesome presentation. But where was the care sector back then?
Well, so we were a relatively new Prime Minister. We perhaps knew it then, but or perhaps it just came up shortly afterwards, heading for a general election. Social care reform was back on the discussion table. It had been the very first thing, one of the first things Boris Johnson had said on the steps of Downing Street, we're going to fix social care. So a bit of optimism around that. A lot of concern about Brexit. At that point as well, we were heading pretty full tilt towards a no-deal Brexit. So concerns about what might be the implications of that. I think lots of ongoing challenges around workforce, around whether the way in which the sector was being delivered through the models of care that we have out there was appropriate for the future ahead. And I think for me, probably, some optimism around where the digital agenda would take us. So I think those are the things that were occupying us then, with little knowledge of what was around the corner. And I think, generally a sector that was definitely feeling it wanted reform and definitely feeling that it was still sitting in the shadows of the political and public focus on the National Health Service.
And when was the first time you heard of COVID-19? What was going on around you at the time?
Well, I think, I like everybody, heard sort of the news kind of focus of it. The first time I can remember raising it directly with the Department of Health was late January. So I think it was January the 26th, going directly to the department to say what's happening, what's the advice we should be giving providers in relation to this, what we were seeing, thinking of it as at that point something that was happening in another part of the world, but that might at some point have an impact on care services. So, that's, I can remember having that conversation with a member who raised it with me and said, what should we be doing about this, and sending through that inquiry then, but not really appreciating, obviously not appreciating what the impact would be, but also not really, recognising that what came back, which was a sort of pretty generic thing around what everybody should do in the context of COVID, was going to be the start of an endless pathway around kind of guidance and policy and so forth over the last 11 months.
And between that period of January and say March, just before the lockdowns, what was the sort of government advice during that period?
Well, so first of all, we had some advice which was just really primarily aimed at healthcare workers. The first time we had anything that specifically looked at social care was towards the end of February. I think it was February the 28th or something like that. That guidance came out. I think in between that time, I was involved in quite a lot of discussions with government officials and with members and others to start to kind of think about what the implications would be. But what was already apparent probably then was that in these discussions, what was coming forward didn't really reflect the reality of how care organisations run, how people receive care at home, the ability of people, both within care homes and at home, to do things like self-isolate, for example. So a lot of the solutions that were coming forward were probably not going to be care sector appropriate. So a lot of our work was about how do you translate that into something that's actually going to be helpful for people to do something with.
And what point did you actually realise that this was a really serious situation?
So I think it's interesting you talk about kind of giving talks and presentations. So I think the last presentations that I did were right at the end of February, and that that's a big part of my job, going out and talking. And I can remember doing 2 or 3 presentations within the space of a day or two, which just over those 2 or 3 days grew and grew. The focus on COVID on them grew and grew, and it was starting to talk about, what are the implications? How are people going to be supported? What are the things that need to be in place? What are the things that we need to make sure care organisations have access to? Which that time was already apparent that access to PPE and so forth was going to be a really important priority. So I think it was just trying to sort of scope out what delivering care in a world where COVID was more present might look like.
So if we move along the timeline to say about March, or when the lockdowns happened, how did the lockdowns affect, first of all, the National Care Forum professionally, but then also your personal life as well?
So in terms of the National Care Forum, so obviously we're a membership body. So whatever affects our members affects us. So we had, interestingly, you might remember we had a very new care minister at that point. So Helen Whately only took up that role on the 14th of February. Part of my job is obviously to try and, help politicians and civil servants and others understand what's happening in care. So one of the things I was trying to do was organise some visits for Helen Whately to care homes, and we got one of those scheduled for early March, and she was unfortunately not well, so that meeting didn't take place. And so I found myself in the office in Coventry, which is our sort of head office, and talking. So I was, expecting to be out and about, but I was unexpectedly with the team there, and we started at that point to think about how we might have to deliver what we did differently. So we, started to think about getting things that like Zoom, which, could somebody look into what the kind of video conferencing options might be? How are we going to work with members if it does transpire that meetings can't take place? How are we going to manage things like conferences, members' meetings, forums, all the things that are kind of our bread and butter delivery to the membership. So we started to have those conversations, and we started to think about how we would connect with the membership in a very different way. From a personal level, I was just thinking your flights cancelled reminded me of what was happening for me at a personal level. So my mum is moved just down the road from me a couple of years ago after my dad had died. So, I'm her kind of primary carer in some ways, although she's very independent and lives on her own. But she had been rushed into hospital in early February, very, very unwell. And my brother had come over. He lives in America. He'd come over to see her, and it had all been very difficult. And so for quite a bit of early February, I spent a lot of time in hospital, and also, working from hospital and, doing all that, trying to kind of manage that. And then he was due to come back again with his family in early April. And we were all due to have a family holiday together with my mum as well. And so because she'd been so unwell in hospital, the conversation was starting to be, well, would she be well enough to have this holiday? Mm-hmm. And then we thought, well, we'll have the holiday, Anyway, lots of these discussions. And then the weeks went by and it became increasingly clear, never mind whether she's going to be well enough, they were never going to be able to come over from America for the holiday. And then, of course, that we would never be able to go either. So that kind of, that the dates are not very far apart, but the sort of momentousness of the issue, the way it kind of grabbed hold of everybody's lives in different ways, was incredible.
Honestly, those weeks between sort of March and April, for me, felt like months. So much happened in such a short period of time.
Yeah.
For us.
Yeah, I think so. I mean, I think it's it just, when you think about, I think obviously, I spent a lot of time talking with members, being very close to members, and just the things that they had to cope with, the things that staff had to cope with. Obviously, we were hearing quite early on some of the very real, the very sad news that lots of people were dying within homes. This was just trying to put yourself in the position of those frontline staff and the things that they were having to face on a day-to-day basis. On a personal level, I've have it very easy. I'm sitting in an office at home, but I was working 12 hour plus days and every weekend as well, but they were doing all that plus having to really be everything for the people that they were caring for, particularly those staff in care homes and nursing homes, and particularly for those looking after older people. So just incredible.
Absolutely. From the general public's perception, they only see what they see on the news. But what were those conversations like? You remember you mentioned you were having conversations with members. What were some of the key challenges at that point? Challenges, concerns?
So I think people didn't know what was happening. I think that's part of, that was part of it. So we were hearing these things, weren't they? That if you were COVID positive, you had a cough and a fever. I think those were the only two things at the time that we were told were the symptoms. And what members were telling us is that's not what we're seeing. It's not people with a cough and it's not people with a fever. It's people with diarrhea, or it's people who are, getting perhaps a fever, but then seeming to get better, and then 8 or 10 days later are deteriorating really quickly. And And, nobody being able to predict that. It was people who were finding that community health services, colleagues they'd relied on and had as part of the everyday life of a care home, were told they were unable to come in to homes. So staff who'd never done insulin injections or heparin injections or whatever were being trained, probably online or by the district nurse, to do these. And then that was sort of handed over to them as a delegated responsibility. It was people who were trying to get people into hospital and finding that hospitals were unable to take them in. I think that the kind of pressure but mostly it was, I think, that overwhelming sense that people didn't know what this was and didn't know, at that stage, didn't really know how to stop it. And of course, alongside that, lots of new guidance, endless amounts of new guidance coming out, and things like, for example, one of the biggest challenges was around PPE, and people being told, lots of different things from a national perspective and from a local perspective, sometimes different instructions, and then thinking, well, how am I going to get this stuff that is intended to kind of be the break between the infection and me and the infection and the people that I'm looking after, but I can't get hold of it, or I can get hold of it, but it's 10 times the price it was last week. I mean, it just I think that, and so what I hope organisations like NCF were able to do is to make people feel they weren't on their own in that. If you're a single home operator trying to interpret all that guidance, I mean, literally hundreds of pieces of guidance, and trying to understand what's happening to your residents and not being able to get the local support that you normally would be able to through health or local authority colleagues because they too were busy firefighting, it's just terrifying, I think.
So much to digest in such a short period of time. Looking back at it, what do you think could have been done a bit differently?
I mean, it was known from Wuhan and, some of the earlier cases in the US, which talked about the impact of the virus on care homes. It was known that this was the most vulnerable group of people. And yet the sort of focus on the physical aspects of how COVID manifested itself in older people wasn't there. As so that people, when they were saying, I've got somebody, I don't know if they need testing, if they didn't have the kind of classic symptoms, testing wasn't going to be made available to them. So I think having more clinical focus on that group of people, I think having the right data to count what was happening in places other than the NHS and not using that as the only measure. And I think the whole issue about how the country as a whole kind of crept so slowly towards a testing regime that was robust enough to deal with what was clearly something that was moving much quicker than anybody. It was the community transmission was much higher than anybody anticipated. But actually, we didn't know that even. We could only see it in almost fixed communities like care homes because that it was affecting the most vulnerable people. So, and lots of people clearly in those settings didn't even get tested, even at that point. So I don't know, a kind of lots of things that I think would have helped us to more identify earlier on just what was going on. I think, to get to a place that people could really say that I understand now what's happening to me and I know exactly what to do in order to put as many things in place to stop it.
Absolutely. I absolutely agree with Vic that the impact COVID would have on the care sector was greatly underestimated. Later on, Vic gives her honest thoughts on the Clap for Carers initiative. We discuss how crucial family visits are for residents, and Vic passionately identifies the wonderful things a career in care can offer. Before that, I wanted to get Vic's insight into how the lack of testing for discharged hospital patients led to COVID cases in homes. So I think it was probably around April 2020, maybe May. And there was a steady stream of discharges from the hospital that were going into care homes. And some of the challenges that some of the providers we work with were sharing was that there wasn't any sort of testing coming in place. And then there was some homes that had absolutely no COVID cases that, fast forward a couple of weeks and months and now been affected, and they look back at that period of the admissions. Did you see any of those types of challenges from your members or conversations around the hospital discharge process?
Yeah, I mean, I think that was even a bit earlier, to be honest, Toby. I think it was sort of late March time when there was an expectation that hospital admissions would rocket up in a way that actually didn't quite transpire then, but we're obviously seeing the effects of now. But I think it's the difficulty without that testing regime was that, again, it was the unknown element of it. So COVID did get into lots of homes, and I think we probably can never be particularly clear how that happened, because some of that might have been through people coming from hospital, some of that might have been through staff, some of that might have been through people coming in from the community. I mean, there were care homes and have never stayed still, in the sense that people don't come and go, and so I think it's very difficult to kind of pinpoint. I guess what that felt like was that there was one bit of the system that was being prioritised over another bit of the system, and in that context, one set of people who were being prioritised over another set of people. So whether that was or wasn't what the seed of some of that virus spread was, the fact is that there was ways in which it could have been managed in a way that we would have known that wasn't the case, which would have been by testing people, or which would have been by prioritising the PPE requirements of care homes rather than hospitals, so that if it was people who had to come in who were COVID positive, that all the equipment and all the support was there for people. And I think that's the bit that people will look back on and say, this was almost, back to your conversation in November, the way that this played out could be looked at through the lens of the lack of reform for social care, and the fact that we went into this pandemic with a set of priorities that weren't changed, even though it was pretty glaringly evident that they needed to be in order for the people who were most vulnerable to be protected.
So in terms of when the lockdowns happened, so no visitations into homes, etc., how do you think the lack of socialisation impacted the residents and the staff?
Yeah, I mean, hugely, I think. Care home staff do an incredible job and will have been, as much as they can, the family that people couldn't see, but they're not the family. We know what makes great care, and great care is built on relationships, and relationships with the people that you love and that are close to you, whether that's families or neighbours or friends or whoever that is. So I think we were hearing from members, there was an element, wasn't there, that everybody kind of accepted that things had to be done very differently for a period of time whilst we were all trying to put a stop to the virus transmission. So I think there was a period of time where people sort of accepted that this is the way things needed to be, and then we were beginning to hear from members some very strong messages that people were suffering because they were unable to be near the person that they loved, or they couldn't understand why they weren't able to be connected. So we did quite a lot of work with the membership to try and with relatives and residents groups as well, to try and understand what the kind of key elements of visiting could be in the context of COVID, and also to say very clearly, before we start to think about opening pubs and cafe, before we focus on what became a sort of political priority around economy. We need to get these people back connected up with those that they love. So some of what, and we worked with, we're part of something called the Care Provider Alliance, and between us we then produced a sort of visiting protocol in mid-June, which kind of outlined how visits could happen and how important they were. And I think prior to that as well, we'd also been, strongly working with the membership and working with, we're part of something as well called Digital Social Care, which looks at how digital can be a big part of the future. And I sat on a range of groups that looked at how technology could keep people connected. So there was there'd been lots of focus on how important this was, even when people physically couldn't be in the same space. And then obviously from June onwards, we were advocating that people could be outdoors in the same space, and where IPC was being used, infection prevention and control was effectively being used, and PPE, that in some cases people were visiting indoors as well.
So you do.
But it was, it's really clear that people need people, don't they? That's the bottom line.
And in what ways did you see technology sort of aid the response to the pandemic?
Loads and loads of ways, actually. So, obviously, from the visiting point of view, the opportunity for Facebook portal and, various bits of technology, some of those software suppliers who've got, relative gateways where you can see into the care planning software. So those sort of things really came into their own. And I think will have shifted the way in which care planning and care delivery is done in a way which might have taken years to do. So there are some things to be kind of thankful for in that context. And without clinicians being able to come into care homes, the opportunity for video conferencing and for people to do sort of remote sessions was really taken up by lots of different organisations. So I think from a digital point of view, it's been a good year in a terrible year in a way, because I think it's shown that it can help unlock some of the challenges we were facing, and I struggle to imagine why anybody would want to row back on that.
Absolutely. We talk about, as a digital agency that works exclusively with the care sector, we talk a lot about pushing the sector forward from a digital perspective, and that the sector was behind. But I think in those months, so much technology enhancement was really ploughed in, to the point of some of our domiciliary care providers were saying they now use WhatsApp groups for their carers. And they do some really creative things. We had a carer on the show, a living carer, and talking about how she helped one of the people she was caring for set up a Facebook account, I think it was her birthday, and they got videos from everyone, edit it together so she could, connect with family. So from a technological point of view, I think it has been, a benefit to the sector there. So moving on a little bit, what's your thoughts of the Clap for Carers initiative?
It's quite interesting, isn't it? The Clap for Carers originally, I think, did give people something. People like to do something, and people couldn't do very much at that time to show recognition. They couldn't go anywhere. They could, it certainly felt more restrictive than it does now in a way. I think from the point of view of raising the profile of care workers and for them to be being seen alongside our colleagues in the NHS, I think it was important. I think the challenge people have got with it now is, we're 10 months on, why are we still clapping? We've got lots of comparators with Wales and Scotland, where, for example, they've given care workers £500 bonuses. There's nothing really in terms of the offer. We have a care system, a payment system to care workers, which isn't determined by the government, but in response to the Migration Advisory Committee's recommendations about additional pay, the government's response was that, we have a national minimum wage. And if that if that is the reward for care workers, that it's national minimum wage, and in this latest budget we're raising that by 2.2%, I suspect care workers feel less than sort of valued in that regime. So I think it had a really important moment, but now I think people will be saying, why are we doing this again, when actually we haven't done anything in between to really change the position of those individuals.
I would agree. I would definitely say that the first Clap for Carers initiative was all over the news. It was widely covered. I think it did really raise the awareness of the care sector to the general public. And at the same time, there were people losing their jobs in retail, in tourism. And we did see, as a digital agency which run campaigns, we saw a huge influx of people coming into the care sector. And we know that there is a recruitment and retention issue. Do you think that the new influx of people, maybe from different professions coming into the sector, will remain once things do once things do normalise?
Yeah. Well, I guess it's imperative on us to make sure they do. I mean, I think it's such a fantastic career, and it is something that, people who I talk to, and I'm sure you talk to, absolutely love doing, because it's rewarding, it's fulfilling, etc., etc. But so I think it's imperative on us to make that as appealing as it is to stay. But I think it also then is imperative on government to recognise if it then does things to stimulate other parts of the sector again. So I think there's two sides to it. One is that we, really get our ducks in a row about what working in care means. So focus on having a proper, even if we can't have the funded reform, have a workforce reform agenda in this year, and then and make it really clear that this is a career for life if people want it. There's lots of things you can do. It's varied, and, all the things that we know and from talking to people. But then equally say we need a rewards structure, we need a payment structure that values it in the same way that the rhetoric that comes out of politicians' mouths sometimes suggest is the case. These are the most amazing, awesome, valuable, courageous, heroic. We'll pay them as such. Don't then say 2.2%, off you go. And don't then, as local authorities, say it's really difficult. We know you've got 2.2% to go up, but we haven't got any money either, so we're not giving any uplift. These things all have a consequence on whether we're able to keep people in the sector. I mean, I've heard, I'm sure you've heard some brilliant stories of people who've come from all sorts of different sectors and have gone, wow, this is incredible. Is this what care is all about? I just thought it was, helping people get out of bed. I didn't think it was about people's lives and what you can do to support and change people's lives.
Why hasn't there been change? It seems like we've been saying this for years and years and years.
Yeah, well, I think you can look at some of the things, can't you? So it's generally a part-time workforce. It's not a very well unionised workforce. It's 86% women working in it. It's people who very often have their own caring responsibilities. We don't have a register of workers, so we don't even have a kind of way of. I mean, that's been fascinating in COVID to sort of see the government realise that actually we don't have any way centrally of communicating with all these people who work in care. Nothing. There's no way of doing it. You have to do it through each and every individual employer. So there's lots of reasons I think why we haven't got that. I think the real tragedy, not the real tragedy, that it would be very remiss of us if we're still in this position after this, when actually it's not possible to say care workers are not visible.
So if we move ourselves down the timeline to about August, the Guardian reported that CQC refused to release which care homes experienced the most COVID-related deaths, and they particularly said for commercial interests. What's your thoughts on this?
I think what we certainly are saying to members is that the deaths in homes were an absolute tragedy, and it is. But what those homes need to be doing is to communicating that to the people who need to know. So that's the families, the relatives of those who are living within those homes, and being as transparent and clear about that information as possible. I think that's what's important, and that message about transparency is central to all of these things, like visiting, like outbreaks, the situations we're in now around levels of vaccination. These are the things that people want to know this, because they want to understand that you're looking after their loved one as in the best possible way. So I think my response to that is that our encouragement is that providers give that information to the people who need to know it.
We've heard talks about the rise of living care as the media talk about care homes. Some would say there's been a negative perception. What do you think the impact's going to be of the care home businesses, care home providers, of the perception of the media, particularly the negative perception that they...
Yeah, so it's interesting, isn't it? So we'd done a bit of public perception survey work, actually, to see how that was, because we're very aware that, actually so we ran something called the Here to Care campaign, which focused on what was happening within care homes during COVID and giving people a kind of clear picture of the things that were going on, focusing on the kind of care, the high quality care that was continuing. And from a public perception point of view, I mean, there's differences, aren't there? There's those people who have never really heard of care before, and the first time they hear about it is that they're hearing about, a pretty negative picture of care, or very worrying sort of statistics about the impact on people in care homes. So I think there's that group of people, and then there is a group of people who are actively considering, either for themselves or for somebody that they have caring responsibilities for, the need for care homes. And I think you probably need to ask those two different groups of people what they think to get a sort of true sense, because I think the people who never really thought about care before won't think will have a pretty negative perception of it, but equally they're probably not going to do anything with that until they do need care. We've not quite cracked it as something that people recognise probably will affect all of us at some stage. And I think things like living care are a fantastic option. We've got members who offer that, supported living services, extra care, retirement villages. These are all part of the broader portfolio, and I think that's why we need that reform to come along, and we need that reform to focus on what do people want in the future.
Awesome. So if we fast forward to now, we're recording this in January of 2021. We're in another national lockdown. What do you think we should be doing to ensure we protect the care sector as much as possible this time round?
So I think there's lots of things we should be doing. So we're back in a situation where we've got huge amounts of pressure on hospitals. So we cannot fall into that trap again and only think of a solution that supports hospitals. So if we're going to talk about discharge again at scale, then we need to make sure that we've got the testing in place, that homes are not being pressured to take people if they're not able to, that we understand that if we've got high levels of community transmission impacting on staff in hospitals, that's also impacting on staff in care homes and care settings more broadly. So we need to we need to make sure we're not slipping back into prioritising one part of the system, if you want to call it that, over another. I think we need to desperately think about injecting more resource into care homes. I think we need to think about where appropriate, funding them to operate at lower occupancy, if that's what will make a difference for kind of zoning purposes, or enabling them to keep people isolated. I think we need to properly scale up this vaccination program. We need to get care home residents and care staff vaccinated as quickly as possible. I know lots of efforts are going into that, but it feels like we have named them priority one, but we haven't necessarily. Usually you try and tick off priority one before you move on to serving priority 2, 3 and 4, and we're doing a bit of everything, which, I understand, but it doesn't give people, this is the stuff that will save people's lives, the vaccination program. We get the testing program right. We're back in, certainly over Christmas, we were back to people waiting 5 to 6 days for PCR tests, those tests that come back from the lab, and we've introduced a whole raft of lateral flow testing into care homes, but we haven't resourced that properly. So you're asking people to do the thing, you're kind of answering the things that we were calling for and been calling for months, and just sort of the risk is it feels a bit like they've been handed over and said, here you are, get on with it. And it's not, this isn't how it should be in a way. If we're going to be able to do this right for the wider community as a whole, homes and care homes and supported living and other places need to be properly resourced to be able to do it. We've got supported living should now be able to access testing. We're hearing that people are, you can register for it now, which is a step forward, tiny step forward, but you still can't get access to the tests. So I think there's a bit, and I think the bit we've got to stop doing is standing at the podium and saying, this is what's happening. Because most of the time when those announcements are made, it's not what's happening, it's what's planned. And we've got to get visitors back in. We've got to, it was great that the new guidance, national lockdown, didn't prevent visitors full stop. But actually, for many people, this is towards the end of their life. And if we're not doing everything, and I mean absolutely everything possible, to mean that they can see the people that are important to them in those last months, weeks, days of their lives, then I think we're, failing them from a humanitarian point of view.
Do you think we'll get back to the point where there was face-to-face contact in visiting around care homes? What do you think?
Well, we'll get back to it. Yeah, we will get back to it. But I think, but only if we try, we'll get back to it an awful lot quicker if we give it the priority that I think it needs, and we owe the people who want
Awesome.
it.
My final question for you, and I'm curious to know your answer. We've done the past, we've done the now. Let's fast forward 10 years from now. In an ideal situation, where would you like to see the care sector, and what type of innovations would you like to see come to fruition?
So 10 years' time, I think let's look at it as 3 different sort of sections of society's views. So I think you would have a huge group of younger people involved in care who would be shaping that, a lot of through a digital lens or whatever we call it by then. Probably something very different, something that's just not even, we don't even call it something, it's just how we work, so that would be, and who would have been hearing about it as a career of choice through a kind of, an academic program that values care and what it does. I think if you then looked at the kind of broader workforce, I think that the roles that people do now will be very different in 10 years' time. So I think we will have used tech to change a lot of the way we deliver care. So my hope is that will feel like a lot more person-led. and that people will be able to control the level of care that they have or want or need, and they'll be able to do a lot more for themselves. So the sort of roles that then people are doing are ones that connect to the emotional well-being of individuals, perhaps more than the physicality of care that's currently there. And then I think in the context of the people who are receiving care and support, that it's something that they've thought about and planned for. And I think the way that you manage that is that you know, whether this is what comes out in any kind of reform agenda, but that there is a logical progression in your life that says the contributions I'm making now and the things that I'm doing for myself will all make up my need for care in the future. So it's a positive choice rather than how it often gets replayed now as a last resort, which when you then talk to people who are living within care homes, they might have felt that before, but they don't universally feel that when they're in there. For many people, it's a very positive choice, but we don't have the language or the imagery or the societal understanding to make it feel positive before you go there. Ultimately, we need a soap opera that's based in care homes, and that people can, you know, that something that enables us to see that to demystify and to make it feel positive and you know, and exciting and different and all of the things that I know it can be, but from the outside it's either doom or gloom or drudgery, and it's none of those. It's sometimes it's a bit of all those things, but what job isn't? But a lot of the time it's passion and excitement and fulfillment, and that's both people working there and the people who are living there. So I think that's where I'm heading.
I think the reality TV show is not a bad idea. You know, only the people in the care homes get to really see the amount of fun and joy that's in there, and the public could really do with some of that in their life. So Vic Rayner, really appreciate you coming to speak with us. Where can people find you or reach out to you and learn more about the work you're doing?
So I run the National Care Forum. You can find us on the web, and you can follow me on Twitter at Vic Rayner, and I write lots of blogs and lots of articles and things like that. And I'm always delighted to talk with anybody who's interested in care.
Awesome. So thank you very much. I completely agree with Vic's call to reshape perspectives on a career in care. I've learned there's no greater job satisfaction than the satisfaction you feel making a real difference in a person's life. And carers do that every day. Thank you so much, Vic Rayner, for joining me on the show, and thank you all at home for listening. On the next episode of Tea with Tobi, I speak to the CEO of Aged Care Technologies, Professor Ian Philp. Ian is not only a professor and CEO, he's also an advisor of the World Health Organization. Ian's insight is incredible, and I quizzed him about the commonly misunderstood true needs for older people. Ian highlights the moment the government lost the trust of the British people, and we take a look at what needs to be done in the next 10 years to save the sector. Before we go, there's just a few quick notes. Make sure you subscribe to the Tea with Tobi podcast so you automatically get notified about new episodes wherever you listen to podcasts. I want to know more about you and what you all think of the show, so be sure to send me your comments at tobi@teawithtobi.com. Please check out our website, teawithtobi.com, where you can find out more about me, Tobi, our sponsor, Meet My Brian, and what we do at Smooth Digital. I've started a newsletter that goes straight into your inbox. So do sign up at our website as well at teawithtobi.com. You've been listening to Tea with Tobi, the podcast presented by me, Tobi Eli-Osman, and produced by One Fine Play. From One Fine Play, James Bishop is the executive producer. Kazra Feruzia is the audio and visual engineer. Connor Foley is the producer and researcher. Additional creative support from Selena Christophers, Jade Cornish, and Miranda Lopez. This episode was recorded by Connor Foley. Thanks for listening to Tea with Tobi.